Hi, this is Dr. Kate D. And today I'm sharing a story of a master esthetician who worked at a really successful, well known medical spa. But what she saw behind the scenes will shock you. And it made her leave that job in less than 4 months. You'll hear what really happens when there's no medical director, how treatments get cut short or faked, and why patients sometimes are just put at risk. By the end, you'll know what the red flags are to look for when you're booking an appointment and also save hundreds, if not thousands of dollars on pretend treatments and hopefully not risk your life having them. She really wanted to remain anonymous. She was worried about retaliation from the spa for speaking up. So I'm going to call her Sarah throughout. So Sarah graduated from Master Esthetician School. Now, Master Esthetician is a designation that is an actual license certificate in only about 8 states. And I'm really familiar with it because we have them here in Washington, but there are 8 states, mostly in the West out here, that have that degree. And what you can do with that is essentially become a laser technician and perform certain kinds of medical treatments under a doctor's direction. They can't practice on their own, but they can do it under a doctor. She got this job at a really well known med spa in the West. And the first thing that she found was that they wanted to pay her under the table. And she felt very uncomfortable. She knew that she herself would get in trouble if she didn't pay taxes on her income. So she balked at that. And eventually they agreed to put her payroll through the regular channels. She said throughout the entire time she was there, she not once met or worked with a medical director. There were no physicians at the spa at all. There was a male PA who came once a week to perform some procedures, and he did do some good faith exams. And what that means is that's the initial assessment and treatment plan that has to be performed by a doctor, or a PA could do it as long as the PA was working underneath a doctor. And again, according to this master esthetician, there's no doctor anywhere. And my guess is that they could not possibly have been covered by malpractice insurance because a PA can't just work for themselves on their own. That's not legal. So the spa would often have patients schedule procedures that they were brand new to the spa and they had not had any kind of exam by a doctor. And this master esthetician was repeatedly asked to perform procedures on patients who had not been assessed by medical personnel at all. And she felt super uncomfortable with this, but she was basically forced to do it. Either you do it or you can't work here. So she continued on for a while, but obviously, it wasn't too long before she felt like she couldn't keep doing this. There were 2 women who owned the spa, neither of whom were medical at all. They were both business people. And they had some policies that made this esthetician very uncomfortable. So first of all, they had a hydrofacial machine, which is a really popular device. It gives you a facial, but it's a device that infuses various fluids and serums into your skin and then vacuums it out. It's kind of like a wet vac for your face. It's actually really cool. It's an amazing way to clean out your pores and do a facial. But anyway, I digress. So hydrofacial is really well known and people will call and ask for hydrofacial by name. And so apparently this spa would run out of hydrofacial serums and they were just using other serums or, cutting corners and using stuff that they had in their back bar. And they would just not tell the patient that. They would just do the hydrofacial and pretend that it was the real thing. And when she asked about that, she was like, oh, just pretend that it's the same. So they were basically, taking money for hydrofacial when they weren't really providing a real hydrofacial. The other procedure she was asked to do was this laser treatment that's used for skin rejuvenation and resurfacing and treating brown spots. It's called the Hollywood Spectra laser. And that laser has 2 wavelengths. In order to do the full treatment, you need to have both wavelengths as part of the treatment. And so this laser, it was half broken. So one of the wavelengths just didn't work. And so she was asked to go ahead and perform that procedure and pretend that both wavelengths work. And again, she's like, but it's only half. And so they provided this procedure and said that it was the real thing, but obviously it wasn't. So They were using a broken laser and she was told to use it anyway. So at this spa, the pricing was never published. It was not on the website and people would get different things and everything was negotiable. If you called the spa and you asked for the price of something and then you didn't book or didn't follow up, they would just say, whoa, whoa, wait, and then cut the price in half. And so she felt that basically they would do anything to get people in the door. I had my own experience with this exact thing many years ago when I was secret shopping a laser device that a rep was trying to sell me. And I decided to find out what other places were charging for it. And I found that, I said, well, I had this treatment at another place, but I'm new to the area and I'm wondering how much it's going to cost. And they quoted one price. And then I said, well, okay, thank you so much. I'll call around. And then they said, wait. And then they halved the price. So apparently that's a procedure they've been doing for a good 10 years. So she said that sometimes the patients would show up inebriated or under the influence of either drugs or alcohol. And she again was told she needed to do the procedure on those patients regardless of this. And obviously for a medical procedure, you can't show up drunk or altered. You have to be able to consent to each procedure. And actually, when you are consented for a procedure, so if you're undergoing a laser or any other medical treatment, the doctor's supposed to consent. So get consent from you. So explain what the procedure is all about, what the benefits are, what the risks are. And you have to agree, okay, I understand what the benefits and risks are and sign a consent form. And obviously you cannot give informed consent if you're drunk. So, but she was asked to go ahead and, do these procedures without informed consent on drunk patients. And they were done anyway. A couple more things she told me about. They did microneedling procedures and this spa provided her very little training for all the procedures she was supposed to do. But one of the things they did provide was training to do microneedling. And she had just been through training in her master esthetician school for the microneedling. And what she found was that the trainer for this med spa was telling her to do it in a way that she knew to be basically old, like nobody does it that way. And so this trainer hadn't really evolved with the times. So she was being taught an old technique, even though she had just learned a new technique in school. And the last thing that she told me about was that they did laser hair removal, but didn't use a laser. So let me just explain how that's possible. A lot of places use an IPL machine rather than a laser to do laser hair removal. IPLs are called intense pulsed light, and they're not really lasers. A laser has one wavelength, and IPL has a band of wavelengths. It's visible light with a filter that provides a band of wavelengths. And IPL is actually quite good at treating red things and brown things. And we have an IPL device that's called BBL, and it's excellent, actually. If you have red splotches, if you've got dilated blood vessels that are red on your face, or if you have sunspots or other sun damage that you'd like to get rid of, IPL, BBL, excellent for that. It can do hair removal. It's not the best. It's very, very slow. It will hurt more if you have a lot of sun damage. It can burn you, especially if you have darker skin. And you can only do light skinned people who have dark hair. Unlike most laser hair removal places will have an actual laser that has two wavelengths on it that they're able to do any skin color and not any color hair, usually, anywhere from medium red to dark. Lasers just can't do the blonde ones or the gray ones. But anyway, so there are a number of places that will offer laser hair removal, call it that, even though they're using an IPL. And that's not completely wrong to do, but it is a little dicey because if you're advertising laser hair removal and you don't actually have a laser, and if somebody comes in and they're really not a candidate because they have medium to dark skin or they have, other conditions where they just can't have it, then it's a little more dangerous. And especially if you don't have a medical director deciding who's a good candidate for that, you very much run the risk of burning people. So bottom line, it's critical, okay, to ask who the medical director is and will you be seeing somebody, either the medical director or a nurse practitioner or a PA, who can do that good faith exam and make a proper assessment and prescribe to you the treatment that you're going to have. Any place that doesn't have a medical director, they are practicing illegally and dangerously. And so really important to look at the website and make sure that they have the staff and the medical director listed on the website. When I looked at this spa that this master esthetician worked at, they didn't list any providers or a medical director. So my guess is they don't have one, or maybe they have rotating people who come and go because they don't, I don't know, but that is really critical. So number one thing, who's the medical director and can I see them? And if not, find out who they are and find out who you're going to actually see. If you go into a spa and see a master esthetician and you've never seen anyone else in that spa and you have any kind of medical procedure, that's illegal. So hopefully this gives you a little more information on how to avoid places like this. And I wish that this person could have come on for an interview. The situation out there where people are really afraid to speak up because they're worried of being retaliated against. They're worried that someone's going to go find them where their new place of work is and put fake bad reviews on their profile. It's really, really distressing to think that this is so common out there. So make sure you know who the medical director is, and good luck finding your next med spa. Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.